I'm Dr. Olivia James from the Equine Practice Company. When I graduated from vet school, like most veterinarians, I was having a crisis of confidence when it came to horses. I used to drive out to calls to go and see a colic with a textbook on my lap, reading as I go. My kids are now of driving age, and the thought of them doing something so stupid just absolutely terrifies me. But the fear of looking silly in front of the client, the fear of missing something in my patient was far greater than the fear of crashing my boss's car and potentially hurting myself. I don't want that for you. I also used to have a list of 5 colleagues that I could call at any time of the day or night. I would give them a call and say, hey, I'm on my way out to see this horse. What do I need to know? What have I missed? Can you help me? And they used to just give me a little bit of reassurance and support and remind me that I actually did know what I was looking at and everything would be okay. So as a new graduate veterinarian, I knew that I knew a lot, but I also knew that I didn't know a whole lot. And that's why we decided to put together the Equine Practitioners program for that exact reason. They contain short, succinct and thorough lectures that is just the information you need right when you need it. So the information is literally at your fingertips. It's in your back pocket on your phone. It's there exactly as you need it. Everything from a clinical approach to a horse with a sore eye, or to examining a horse with colic, or even how to examine a horse with mild lameness. That's a really scary thing for a new or recent graduate. You've got the owner telling you it's in the shoulder, you've got his neighbour over here telling you it's in its hip, and you're expected to perform and look like you know what you're doing and reach a diagnosis in a short amount of time. So we start off with a series on clinical approach to a horse with a sore eye, clinical approach to a horse with lameness, how to decide if a colic is a surgical or a medical colic, clinical approach to the itchy horse, clinical approach to lumps and bumps. So it's bridging the gap between when you get the phone call to go and see a horse for an appointment and you actually reaching a diagnosis. There's plenty of information out there that takes a really deep dive into specific syndromes and to specific diseases. Where we think there is a gap in the market is how do you get from that phone call to actually reaching the diagnosis, and this is where we're looking to step in and to support our colleagues in the veterinary industry. We start off with a series of lectures on the clinical approach to. There's about 200 videos in there, everything from a horse with unilateral nasal discharge to a horse with pruritic skin to a lethargic foal to a lame foal, and everywhere in between. We have about 200 conditions that we are covering. Following that is some how-to sessions, so very short 15-minute videos on how to perform particular procedures. So we don't need to know the history, we don't need to know the fluff, we don't need to know what the cutting edge of science is. This is delivered for practitioners in the field who just need that information immediately. They don't have time to go and read it or to look it up. They just want information that's right there, right now, at their fingertips, then they can go and perform the procedure. We have experts in their field. We have hundreds of veterinarians and colleagues from around the world who are contributing to this product because they see the value in education and supporting our veterinarians in this very small industry. Less than 1% of veterinarians are graduating from veterinary school and are going into equine practice. We are a small industry. We really need to stick together and support each other. We have some additional information on fundamentals. For example, we have a video on the fundamentals of acupuncture. I don't know how to do acupuncture, I don't know how to do chiropractic work, but I would like to know the basics of it. I don't want to go and spend 10, 20, 30, 40 hours learning. I just want to know the fundamentals of things like acupuncture and other modalities that I don't have expertise in, and I need to know enough that when my clients are asking for my opinion or a question about this, I can confidently and competently answer them because I'll know a little bit. Benefit for you as the veterinarian is having the information right at your fingertips exactly when you need it. It is literally in your back pocket. You can listen to it as you're driving out to a call. Please don't watch it. I don't want to be responsible for anybody crashing their car. These presentations have been presented by experts in their field. They're very short, they're succinct, they're without the fluff, without the history, they're without the deep dive into the science or the background of this particular condition or clinical approach to. It is very short, sharp information exactly when you need it. So don't miss out. This is an opportunity that you can grab with both hands to increase your level of skills, knowledge and confidence in equine practice. We're here to help you. We're here to help and support our veterinary colleagues, and this is absolutely a collaborative effort by hundreds of veterinarians all around the world who are presenting in their areas of expertise for people just like you. So don't miss out. Click the link below to get your seat.